you might hear me say that a lot. It is not to reduce the quality of services. It is to make sure that we match the requirements of state and federal regulations. Hi everyone, my name is Mariam Treystman from the Home Health Consultant, and today we're going to be talking about patient satisfaction surveys. But first, if you like our content, please like, share, and subscribe. So what are satisfaction surveys and why do we need them? Satisfaction surveys are a way of capturing patients' perception and, of course, family, caregiver, whatever, perception of your services. The reason this is important is that it's going to reveal a lot of interesting information to you that you can then use to improve your program. Because Home Health and Hospice has such a large emphasis on performance improvement, so much so that they made it a conditional requirement via QAPI, having the patient perspective is integral and legally required. So how do we collect satisfaction surveys? Well, there are various ways that you could go about this, but I'd like to start this whole section with saying, if you have signed up to Home Health or Hospice CAHPS, then you don't need to do any additional or supplemental patient satisfaction surveys. The CAHPS program fulfills the satisfaction survey requirement in terms of the regulatory kind of like requirements, rules, regulations, and so on. And so once you've hit the number of patients you need as a minimum to participate in the HH or Hospice CAHPS surveys, you no longer need to have additional, supplemental, or different patient satisfaction surveys. That doesn't mean that you may not want to capture other information than what's included in HHCAHPS or Hospice CAHPS. The CAHPS system has standardized questions required by CMS that's collected by third-party auditors or contractors and reported to both the agency and CMS. They ask about patient perception and family perception around the quality of care, the timeliness of services, and also they're looking to weed out things like kickbacks and like other kind of like fraudy moments like that. This is all great, helpful, and actually a really great way for CMS to kind of rank agencies, and obviously they are going in that direction with value-based purchasing in home health, and then increasing the number and scope of questions that will be reported from HIS to HOPE now. So anyways, CMS is looking to increase just the general data that they're receiving and the agencies have so that they can improve their services. But as an agency, you may want to ask questions that are different than or separate from the CAHPS structure. Or simply, you may not have enough patients to qualify for CAHPS. Another little caveat is you can sign up for Home Health or Hospice CAHPS with just one patient. You don't need to hit their minimum requirement. That's just the number of patients that you need to have it be mandated to go into the CAHPS system. But either way, if you are trying to collect separate satisfaction information or don't want to pay for CAHPS if you are not hitting the number of patients with your census that's required for CAHPS, then here are some ways that you can collect patient satisfaction data. First and foremost, you can call patients at random times and do phone collection surveys. You come up with a list of questions, you come up with the number of patients you're going to contact in a given time frame, and then you proactively call them and ask those questions. You will have to decide how often you do this, how many patients you will collect data from and on, and whether the data collection will end up being anonymous or not. Because when you're talking to patients, you don't have to document who it is you spoke to if you choose to have an anonymous response. Of course, it is helpful to know which patient it is you've talked to in case the satisfaction data comes back negative, so that you can address their concerns and the issues that they've had with your care. But other times, anonymous selection and sampling and data, the data that you get back can be helpful as well. Because when you don't know specifically which patient it is that is giving you negative feedback, then you have to apply that negative feedback across your entire program. Another way that you can collect satisfaction data is you can put like a satisfaction form with a self-addressed and pre-stamped envelope into every patient home folder. You can instruct them to complete this at whatever time points that you deem necessary, depending on the information you're collecting. Typically, people will do this at discharge. A good time is when you give the notice of Medicare non-coverage. You can also give a satisfaction form with that, have them complete it, and send it back to you in the envelope or give it back to the clinician. We highly recommend that if you're truly trying to capture real feedback from people, that first you make it as easy as possible for them to give you that feedback. Secondly, you make it anonymous for them so that they don't have to tell you stuff or write their name on something and give it back. That is going to be the most honest response you're going to get. But of course, as we've just mentioned, there are some benefits to knowing who replied and so on. It's a little unethical to present things as anonymous, but then have some kind of like indicator as to who it is. So just consider those things. Like I wouldn't go that route. You know what I mean? The important thing in all of this patient satisfaction data is that if you are not part of the CAHPS system, you have to collect satisfaction data proactively on your own, whether it's through a call, anonymous form left at the patient's house with a self-addressed stamped envelope, a clinician face-to-face with the patient collecting satisfaction data, supervision on another clinician, and also a family interview. However it is, whatever system it is that you have put together to collect the data, that data must be collected by law. This is one of the required elements of your QAPI program and just of general kind of like, home health and hospice program. Like CMS requires that you get patient satisfaction data. You may want to have additional satisfaction questions based on a QAPI that you're doing or based on, some processes that you don't like or feel suspicious about sometimes. Since we are not from the office perspective, like from the administrative perspective, we are not in the field with clinicians and are not present for all those interactions. There could be times that you may be suspicious of a process and so on. And so getting it from the patient often is going to be the best way to go about it. For example, you could have, this is an extreme case, but let's say a patient come back and say, I saw my nurse 3 times total in the care, but you have weekly submission of notes. Okay, this is obviously like critical red flag, problem, and requires investigation. Well, the best way to investigate this is to go ask all the other patients involved with that clinician. So you might be incorporating patient satisfaction or patient perception and experience questions throughout your program for various reasons. The important thing is that you're doing it. Please, please, please make sure to review your policies around patient satisfaction. You have 2 options with policies. You can match your behavior to the policy, or you can match the policy to your behavior. The most important kind of concept with this is that both of them need to hit the minimum requirements of the law. That's it. I am a big proponent of double checking what the rule is, not just going by whatever policy book you bought, what they said. A lot of times, the companies that make the policies that you are purchasing will make general kind of policies that could comply to all over the place, to any kind of like rule structure there is. Yes, they will have separate, for example, accreditor, right? Like ACHC or JACO or CHAP or whatever. They could also have like, this is special for California and Missouri and whoever has like additional licensure requirements. But the base could still be some above and beyond stuff that they got from like initially when they wrote it for everybody, and now it's kind of carried through and so on. So you want to make sure that your policy minimally matches the regulation. You can always do more than what the regulation is and what the policy is, but you have to, at minimum, hit those things. One thing that I'd like to notify everyone of, just kind of look out for, is you could purchase forms from anywhere, as always, right? Like various companies sell various forms or provide them online or whatever. The way I like to write my patient satisfaction forms and the way that we have them in our administrative compliance program is of course, to collect patient satisfaction information, but we also write certain questions in a way that confirms your adherence to critical conditions and other regulations. For example, the top deficiency amongst every single accreditor is individualized plan of care. And so in our patient satisfaction survey, one of the questions is, were you involved in the creation of your care plan? Well, if you have enough patients that respond yes to this, and then you have a surveyor that's trying to say, this is a not individualized plan, you have this issue of not individualizing plan. Well, guess what? The patient says they were involved in creating this care plan and that it is unique and specific to them. It gives you a leg to stand on in case you get some weird, deficiency that may not actually represent your service. And so those are kind of like little backup ways of like justifying your care, justifying your processes, and like really validating that you're doing all this stuff. So that's how we approach satisfaction surveys in our administrative compliance program. It is to capture critical process elements, patient perception and satisfaction information, but also to confirm that we are doing the things that we know surveyors are looking at and scrutinizing so that we are less likely to get deficiencies in those areas. So those are kind of like the important elements of satisfaction surveys. You want to make sure you're doing them, especially if you're not signed up to the CAHPS program. Like, you have to be doing this. Absolutely. Check your policies to see the frequency, scope, and so on. And if the policy goes much further than the accreditor standards and the just CMS regulations, unless you are very resource heavy, like you have a lot of time, like your office people have a lot of time on their hands, or, whatever, like do your own assessment. I would reduce the policy to match what's happening in real life and what the actual rule is, not just like what someone made up as a policy. You might hear me say that a lot. It is not to reduce the quality of services. It is to make sure that we match the requirements of state and federal regulations. This is kind of like, I always bring this example because I feel like every person on earth can just like relate to this. This is the same as the way we eat. If you attempt to eat every day, eat clean on this perfect, like no mistakes, exactly at these times, I have this much water every day, right? Like you just like go with the maximums, like what pro athletes do when they're like preparing for their athletic competition or whatever. Okay, that's going to last like 3 days and that's it. You have to find reasonable ways of incorporating healthy habits into your life and then iterating on that until you reach whatever level of quality you're ultimately like hoping to achieve. If you go from like eating like Snickers and Taco Bell every day to like only eating like super clean, That's not going to last. It's just not, I mean, maybe you're better than me, but for me, it doesn't last. And so same thing with this and with just regulation structures, you want to hit like the rules and then work on improving above that. But let's start with getting to the rules and making sure we're maintaining the rules. Same thing with satisfaction questionnaires, satisfaction surveys. Get to the minimum and then go above that. So that's that. That's about patient satisfaction. Make sure you're doing them, especially if you're not signed up to the CAHPS system. If you are signed up to the CAHPS system, then you don't have to do separate satisfaction unless you are looking to capture specific information. Please make sure your policies match whatever it is that you're doing and that they match and hit the minimum of whatever your state and federal law is. And that's that. This is Patient Satisfaction Surveys. My name is Mariam Treystman from the Home Health Consultant. And if you like our content, please like, share, and subscribe. Thank you.